Hi everyone, Dr. Hannah Strom here, pelvic health physical therapist, and I'm here today to talk to you about what the heck is the pelvic floor. So as a pelvic health physical therapist, one of the number one questions that I get from my patients is, what is the pelvic floor and do I have a pelvic floor? And the answer is yes, everybody has a pelvic floor, and we're gonna dive into what exactly that means. So to orient yourself, I wanna show you my pelvic model. I show every new patient this model so that way they have a better understanding of this area of their body and some of the things that we look at and evaluate. So this is your pelvis. This is the bony pelvic girdle. So here's the front and this is the back. So if I bring it back to the front again, we can see that there are different bones that make up our pelvic girdle. So these here are the top of like what we would call your hip bones or your iliac crests. In the front is your pubic symphysis right down the middle and your pubic bones. So you can see like just how wide these pubic bones actually are. Then if we turn it to the back, we can see the low back or the lumbar spine, kind of the lower lumbar segments here. Again, the top of the hip bones, or what we would call the top of our pelvic bones. And then our sacrum, which is this triangle shaped bone at the back. Where the pelvis and the sacrum come together is called the SI or sacroiliac joint. And then down here at the bottom is our tailbone. And then if we look actually at the bottom, we can see the two bony segments here. These are our sitting bones or our ischial tuberosities. And then the fun part is looking at all of the muscles. So we'll start with the pelvic floor musculature, and there's actually 3 layers of muscle to the pelvic floor. So the most superficial layer of our pelvic floor is actually right here. So if we removed all of the skin and kind of adipose tissue, we would see all of this muscle in red. So these muscles right here, they kind of form a triangle in the front and kind of like another triangle in the back, are the layer 1 of the pelvic floor muscles. So they kind of have like a sphincteric or a closure function around the urethra, which is where urine comes out, around the vaginal opening, or also the base of the penis in men, and then around the anal opening. So they provide, again, like closure functions for kind of our bowels and bladder, as well as sexual function. And then if we removed that muscle, we would get to some deeper layer of pelvic musculature, which I'm actually going to show you from the inside. So before we dive into that deeper layer of pelvic muscle, there's a lot of kind of awesome organs that are situated inside of our pelvic cavity. So I'm going to show you these organs one by one so you have a better idea of what actually lives inside of the pelvic cavity. So right in the front here, right behind the pubic bone, you can see that we have the bladder. So the bladder truly is like a little, almost like a little spherical shape. And there's a muscle around the bladder called the detrusor that contracts to help urine out. So that sits, again, right behind the pubic bone. So sometimes in people with like bladder pain or pain in kind of their like bladder area, sometimes it can be due to muscles that sit right next to the bladder. And that would just be determined through an evaluation or an assessment. Behind that, we have in women the vaginal canal and the uterus here. So that just sits right behind the bladder, and the uterus kind of sits up and over that bladder. And then behind that, we have the rectum, which stores stool. So that will sit right behind the vaginal canal and the uterus. In men, obviously, there is not a vaginal canal or a uterus, but there is a prostate, which actually sits just underneath of the bladder here would sit that prostate. So you can see how there's a lot of organs and kind of not a whole lot of space for these organs to sit. And in pelvic health physical therapy, we're often dealing with people that have bowel, bladder, or sexual dysfunction. So pain with urination, difficulty with urination, or urinary leaking or incontinence, bowel issues such as constipation or emptying the stools, and then of course pain that comes from that vaginal canal or with sexual intercourse. Then if we look at this kind of top-down view, we can see that these muscles literally sit like a bowl or a floor at the base of your pelvis, running right from your tailbone all the way to the front to the pubic bones, and then side to side here. So sitting like a hammock or a sling to support these organs, and also to provide stabilizing functions for your low back, your hips, and your pelvis. Because of how these muscles attach to the different bones of the pelvis and the low back, part of the tailbone, low back pain, hip pain, or tailbone pain may actually have some relationships or some dysfunction from the pelvic floor that is driving that pain or driving that issue. So we really like to say that this pelvic floor, these muscles, have 4 primary functions: stabilizing, sphincteric functions, so like closure functions, sexual functions, and then supportive functions. So with stabilizing functions, as I mentioned, that pelvic floor literally provides some stability to this pelvic girdle, to the low back, to the hip joint. Sexual functions, these muscles kind of rhythmically contract and relax during intercourse. They also need to have good length tension ratios to not have pain with, say, penetration. Then, of course, sphincteric functions to help kind of close the urethra, so urine doesn't leak out or close around the rectum and the bowels, so that way there's not any sort of fecal leakage or issues there. And then, of course, supportive functions to help support these organs in the pelvic cavity, so that way everything can be kind of held in place and supported well. So you can see that there's just a lot that the pelvic floor does and a lot of different functions that it has. And when something has many functions, there can be things that go wrong. So don't hesitate to reach out, give us a call, send us an email. If you have any questions about how we can help and how we can help optimize your pelvic health, optimize just your general health and wellness, so that way you don't have to live with pelvic pain, urinary leaking, low back pain, hip pain. We kind of treat all of it, and we dive a little bit deeper into these areas to help you find lasting relief and get back to the things you love. Thanks.